It's your eye health experts, Prevent Blindness Texas, and welcome to Eyespiring, a conversation about all things vision and life. Welcome to Eyespiring with Prevent Blindness Texas. We are inspiring a brighter future and vision. I'm your host, Heather Patrick, CEO of Prevent Blindness Texas. We are so glad you're with us and excited to be launching our podcast. The mission of Prevent Blindness Texas is to prevent blindness and preserve sight. Our vision is vision, making healthy eyes a priority in Texas. For almost 70 years, Prevent Blindness Texas has provided critical vision care to Texas' most vulnerable citizens by providing early detection, screening, education, navigation, and financial resources. We focus on vulnerable and underserved populations most at risk for vision issues. Last year, Prevent Blindness Texas served over 50,000 individuals and educated more than 80,000. We work to build strong continuums of care in each community we serve so that all children and adults have improved equity to access quality eye care. We know that vision critically impacts learning and development, mobility, independence, and health. We advocate for the necessary attention and solutions to issues surrounding the aging eye, and we define success when all individuals who need eye care receive it. Our work improves the health and quality of life for thousands of individuals across our state. I have been in nonprofit healthcare for over 20 years. I am passionate about improving access to care and advocating for our patients. This work is important to me because it's still a solvable problem. More than 50% of blindness can be prevented. I recently just completed a 6-month health coaching program. I'm a mom of 2 fabulous teenagers, and I lead the team here at PBT. Now I'd like to introduce you to our guest, Dr. Misha Syed. Let me give you a little bit of her bio. It's extensive, so I'm going to highlight some things. She completed her undergraduate studies at the University of Texas in Austin, then attended Baylor College of Medicine, where she earned her MD degree in 2001. She became a faculty member at the University of Texas Medical Branch in Galveston in 2006 and was promoted to the rank of tenured professor in 2020. While practicing at UTMB, Dr. Syed completed a Master of Education in Health Professions degree from Johns Hopkins University in 2016. She's been active as a clinician educator and a glaucoma specialist, serving over 20 committees locally and regionally and on over 10 national committees. She serves as the Ophthalmology Residency Program Director at UTMB from 2011 to 2022. Her leadership roles include being elected to the National OPU. Is that right?
We call it AUPO.
Okay, well, Association of
I like OPU though.
I like that. See, we created something new already.
There you go.
Association of University Professors of Ophthalmology. Program Director Council and co-founding Women's Professor of Ophthalmology, a national organization devoted to mentoring women in academic ophthalmology. She now serves as Assistant Dean for Educational Affairs, John Seeley School of Medicine at UTMB, and as a Vice Chair for Academic Affairs in the Department of Ophthalmology. And she is a Galveston native and has enjoyed living close to her family, friends, and the beach while raising her 2 children with her husband. So clearly she doesn't have anything to do. She's not busy at all. All right, so tell us a little bit more about you and your story.
Sure. Thanks, Heather. I loved hearing yours. I wasn't aware of the full path of your career, and I hopefully we can get more into it as we're chatting over this next bit of time. But I'll reiterate that I am kind of a quote unquote native of the area. I moved to Galveston when I was about between 4 and 5. So all of my primary schooling was done on the island, and I have a really strong connection to the island because of that. It was an amazing place to grow up. I still have many of my childhood friends that I'm close with, and I think that gives an extra special connection in my work as a glaucoma specialist, serving the community of Galveston and the surrounding areas. And I would say that the ties that I have made during that time in childhood and since I've come back to the island really strongly have shaped where I've gone with my training and my focus. I had the opportunity to volunteer a lot as a kid on the island. So think that being able to serve in those ways and seeing some of the issues that people in our community had really led me on the path towards first medicine. But then also this idea of prevention and public health was a seed that was planted early. I not aware of that at the time. I don't think I was really kind of growing that in subconsciously almost as an important part of my later career, but understanding that true health starts with prevention of disease and having a strong health connection from an early age, having resources, having the ability to access care will completely change the trajectory of a person's life. So with that, I went bright-eyed, bushy-tailed, eager into medical school. I thought that I was going to go into preventive care in general. You know, I was very interested in actually obstetrics gynecology and did some research as a medical student in that area. And particularly interested in cross-cultural issues in medicine and how to treat people from diverse backgrounds. But you know, things change. So somehow I went from obstetrics to gynecology to ophthalmology. There is a serendipitous story with that as well, and it does tie back to the idea of preventive care. Believe it or not, a lot of people think of ophthalmology as a super specialized surgical specialty, which it is. But there's an incredible opportunity to really ensure optimal eye health throughout one's lifespan if you practice ophthalmology from a preventive aspect. So what ended up happening, I was going along in medical school and had no idea of ophthalmology, as a specialty. I had my path, and I actually got to do an elective rotation in ophthalmology just on a whim. I had kind of morphed from obstetrics gynecology to being interested in pediatrics and adolescent medicine, again with that preventive idea in mind, how to optimize health from an early age. And I thought, well, I really need to learn how to do a good eye exam. In most medical schools, you don't get a lot of exposure or training in ophthalmology. And so I thought, let me do a little 2-week rotation here, and just fell in love with it. I'd always loved the OR. I loved the aspect of procedural care and being able to kind of have an immediate impact and a positive impact on patients through that. But I'm kind of giving that up with, no, that doesn't really fit in with what I want to do and how I want to help patients. But ophthalmology just beautifully tied both of those things in. You can take care of the whole patient from early age to late age, but you can also intervene and have really life-altering impacts with procedural care. So that's how I pivoted and went on to residency. Loved ophthalmology, but I still had that thing in my head, like, how do we ensure that patients are not coming to us with vision loss already in that, the downward trajectory of losing their eyesight. And I found the field of glaucoma. Glaucoma can often kind of sound like it's a Debbie Downer in our specialty, if you want to label it. There's a lot of challenge in treating the disease, and often patients do come to us with irreversible vision loss with glaucoma. But there is a really, as of yet, still, I think, largely untapped opportunity to prevent glaucoma, to prevent that vision loss, if you have the right type of screening in place and community awareness, and going back to that education piece, educating patients about getting their eye care regularly and early enough in life to catch diseases like glaucoma. So that sparked my interest again in preventive care and how we can really affect that positive change as glaucoma and specialists and ophthalmologists. So that is how I started my career as a glaucoma specialist. I did my fellowship training in Houston. And in the meantime, I had gotten married when I was still out of state doing my residency. My husband was in the Houston area. I knew I wanted to get back to the area. I still have family in this area. So it kind of, the stars aligned. It was really fortuitous that UTMB needed a glaucoma specialist, academic glaucoma specialist, at the time I was finishing fellowship. So there I was. And I was that, 18-year-old kid when I left, like, I'm back here, even though, as I mentioned, I loved Galveston, but as a young person, you're like, I'm not going back to my hometown. That's not happening. But I was there. It's starting in 2006, right out of fellowship. And I'm an anomaly in a way because that's been my only quote unquote real job since I got out of training. I've been at UTMB and have had a really, I think, an invaluable opportunity to grow myself, grow my career, serve my community through my work at UTMB, and I've never felt the need to go anywhere else. So here I am.
Yeah, they're a great institution. Amazing.
Yeah.
All right, so you've told us a little bit how you got there, why eye health is important to you. So, what inspires you now? So, prevention was really important then, and obviously it's still important to you. But what else inspires you? Because this role can be daunting. It can be really hard when a patient walks in and there was more they could have done, and now they've lost vision and they can't get it back, right? Those days are hard. So, what inspires you? What brings you back to your why?
I'll tell you that I think to be in medicine in general, you have to grow that ability to deal with the sad situations and the inevitable misfortunes that befall your patients, regardless of what you can do. As you said, there are limits, and unfortunately, we are always going to see those cases that just can pull you down. I would say my antidote to that has really been teaching.
Mhm.
The education piece is I I kind of fell into teaching. It wasn't intentional. I knew I really enjoyed being in the academic setting, which is part of why I took the job at UTMB, but I don't think I fully understood why I really enjoyed the academic setting. Part of it is the collegiality you have when you do have difficult cases and those patients you're just not sure how best to treat. You have a colleague down the hallway that you can pull in and say, well, what would you do here? That's not always the case in the private practice setting. So that has been a real positive aspect and a growth opportunity for me as a glaucoma specialist. But what I didn't realize is as I had the residents and medical students working with me day in, day out, the ability to instill in them the values and the understanding of what we're talking about here, which is preventing disease in whatever way we can, educating patients, educating their families, having that role as kind of the steward of their care, I think has really filled my cup in a way that I don't know that I could. Like you said, it's hard. Days are hard. You have difficult cases in the OR. There's always those challenges, and you think, gosh, this is draining and it's sad. And without that piece of being able to pull in the next generation and say, yes, this is hard, but this is what you can do to make things as good as possible for your patient. And this is how you treat people, not just the disease, but treating the patient, treating their family, and helping that next group of physicians who are coming up and who are going to be taking care of us, quite frankly, um, helping them learn those values and understand that part of who they are as a physician. That's what helps me.
I love the phrase, "We're the steward of their care."
Yeah.
I love that. I really, and I love your philosophy, and I wish all doctors had it. Like it's more about treating the person, right?
Yeah.
Um, okay, so who inspires you?
Mm. Wow, that is a huge list. I I'll say, I had a really interesting conversation actually before we started the podcast this morning, earlier this morning. I had an incredible opportunity to connect with one of my high school teachers. It's a long story,
Okay.
but going back to the Galveston connection,
Yeah.
she and I had almost an hour-long conversation earlier today. And I told her, I said, you and all the other teachers I had in
Mhm.
K through 12 have no idea how much you inspired me to, again, go this route of teaching. I had no idea that I would end up being an educator. when I was going through those grades in school, but I do know that their ability to interest and inspire their students, and to make us love learning. I don't know that I had any better inspiration than that. And it was, again, a subconscious thing. And now that I have the years behind me, every year I feel like I learn more about kind of how these seeds were sown. But
Yeah.
it was my teachers, I think, collectively. My husband and kids laugh at me. They're like, "You're so weird. You remember all your teachers." I literally can name off my teachers from
Me too.
kindergarten to 12th. Thank you. Okay, so I'm not the only
Me
one.
too.
They think that's bizarre. And I'm like, no, I mean, I can even remember instances from, first or second grade where a teacher said something to me, gave me an opportunity, and something that small is actually something huge.
Huge. Huge.
So
Yeah.
teachers, God bless them. And they have a really hard job, but I hope that, and I wish that they all knew how influential they are.
Yeah. Yeah. I mean, my second grade teacher changed the course of my path. She saw something in me, and talked to my parents about putting me in the honors program at that time. And they did. And that just set me on a different pathway. So they definitely have the ability to really change our course. So, yeah.
Yep, for sure.
Okay, so we've talked a little bit about community, and obviously the Galveston community is important to you. Is
Mhm.
there a larger community too that really kind of drives you? I know you're involved a lot with supporting women and women's health. So maybe
Mhm.
talk a little bit about that community and how you got involved and what keeps you going there, and what you see kind of changing or evolving as you're part of that community.
Yeah, I love that question. So I entered medicine at an interesting time. I think I was right on kind of the bubble of when medical school enrollment started to shift from majority male to closer to a 50-50, not quite, but it was starting to turn. Now it's 50-50, even a little above 50% in a lot of medical schools of female versus male enrollment. So at the time, there weren't many female role models, particularly in the surgical subspecialties. So ophthalmology being included among those. I really felt that when I was going through medical school and then starting my residency. I could count on one hand, the number of women faculty that I worked with,
Mhm.
and that was striking. I don't think that it was negative per se. I had amazing male mentors. Like I never felt like it was somehow, I think, affecting my training or my education at that time. And then as I went through and became a young faculty member and started to build this academic community, going to meetings, joining different organizations, the topic kind of would come up, particularly with other women, and kind of talking about, well, how are you getting this opportunity, or how are you being mentored, and it really did become apparent that there is a difference.
Mhm.
Women in medicine have different challenges and kind of unique situations that really require a connection with those who are having the similar experience to help them grow. And again, not to say that there are many men who are avid supporters of women in medicine, and I have many really strong male mentors. So again, they'll never fully understand the experience, I think, is the thing, and finding that niche of women who have kind of been through similar things and have done it before you. The value of that cannot be overstated. So with that in mind, I started to try to join various organizations that kind of allowed me to interact with women who had a similar path. And joining the Association of University Professors of Ophthalmology, which you had mentioned earlier, that's an academic ophthalmology organization. And essentially, if you're a chair of a department, a residency program director, a medical student educator, a research director, that's kind of the home for you, that professional organization. And that's your tribe, you know, and it really felt that way. When I became a young program director, I was really given that job very in a very interesting way. My chair basically called me one night, and he was famous for doing that. And when he called, you picked up the phone, and I had my, you know, 5-month-old daughter and my 3-year-old son at the time. And actually, I remember the night he called. We were going out for the first time pretty much since I had my daughter, and we're going to this loud Mexican restaurant, and it's chaos, and you know, she's throwing her food, and my son is running around the table, and I see the phone ringing, and I'm like, oh my God, okay, I have to take this call. And like, and I answered and I said, yes, hi, how are you, blah blah blah. And my my chair was very amazing chair, very strong, you know, supporter of my career, but did not beat around the bush. So basically the next words out of his mouth after he said hi were, how would you like to be residency program director? And big job. I don't know how I can really explain that job, but it's essentially you're in charge of the residency training for all the residents in your program. And it's very tightly wound around keeping the program accredited. You have to follow all the rules from the national accreditation body, which is the ACGME for short. But essentially, if you don't follow those accreditation guidelines, your program can close. And there are big ramifications for that. So anyway, it's a difficult position.
Big job.
Yeah, very big job. And I was at this time, I think I was 4 years into being a faculty member. So literally, you know, still getting my feet wet, still understanding my clinical practice. And I think a recurring theme has been for me in my career growth is when the door opens for an opportunity, you know, walk through it. It might be scary, but you know, walk through and see where it takes you. So I had a conversation with my husband. I said, look, this is going to be crazy pants where we have these kids. And, you know, he was busy with his work, and he was like, look, if you think this is going to be something good for you and you think you can do it, go for it. So that's what I needed to hear. I think it helped me to take that, you know, the nudge and go, and it changed the trajectory of my career. Absolutely. And becoming a clinician educator, I found within that group of women who are going through the same thing. AUPO supported our efforts about how long? Maybe 14 years later. So 2020, we'll fast forward. A colleague and I were chatting one day, and we'd both just been made professor. And she's in Chicago. So, you know, we had connections obviously through the organization, et cetera. And I said, well, how did you do it? She was like, you know, I don't really know. It's like, I'm either. So the path was, you know, circuitous, and we both got there, but we thought, gosh, how much better would it be for the people coming behind us to have some kind of scaffolding, somewhere where they can go in this very kind of small part of the academic world, academic ophthalmology, women going through these paths. And there are national statistics, particularly in ophthalmology, that there is still quite a gender disparity in women who achieve the full professor rank. It actually inverts by the time you get to full professor. As people enter their career, assistant professors is actually slightly more women than men. And as you get to associate and full professor, it flips on its head. And there are, I think, the latest statistics, I don't want to misquote, but it's probably around 10 to 15% of full professors are women. So if you think about that, yeah, it's an inverted pyramid, and it's or it's a pyramid, I guess, but it is a problem. Gender equity in this field in our area is a problem. So that was our point, our pivotal point, where we said we need to create this. And that's how Women Professors of Ophthalmology was born. We didn't have a home for it. We ran it through our laptops basically for a year or two, playing our Zoom meetings, had to get a listing of all the full women professors in the country, somehow kind of put together a group of women who were interested in joining the effort. And AUPO ended up supporting us and putting us under the umbrella of AUPO, which has been amazing. And we have some wonderful sponsorship. AbbVie has supported us for the last few years through AUPO. So really, it's been an amazing chance to give back to the academic community and help those who are coming up behind us. So incredibly rewarding.
Yeah.
I don't know if I answered the question. I feel like I went off on a
Still back to that training and teacher, right?
Yeah.
Support, that leads support. So, all
Yep.
right. So let's shift a little bit
Mhm.
to PBT
Yeah.
and talk about how you got here and then why you stayed.
Yes.
And then also to your journey in the organization, landing with last but certainly not least as chair. What does that mean to you and your
Yes.
your path?
I also count PBT as a very uh, pivotal and serendipitous moment in my career, talking about how we have today, how building ties to community and finding ways to prevent disease, eye disease, glaucoma in our patients, and how I was able to work on that from my perspective as a clinician. I did feel like something was missing in that I didn't have that larger framework of support and understanding of how do we create this community partnership where we can really tie patients into access to care, education. I can do my piece in my exam room in my clinic and do that individual teaching, but how do we make it a bigger positive change, right? And a effect that's more community oriented and longstanding. So enter Dr. Murphy, Kathleen Murphy at UTMB, who I know has been a longtime PBT supporter and heavily involved in the organization. So she and I were an Academy of Master Teachers meeting that we have at UTMB. It's a community of educators within UTMB and people who have really shown interdisciplinary commitment to teaching. So Dr. Murphy is in the School of Nursing. I'm in School of Medicine. So that group has really allowed me to make so many connections with people outside of the little niche and silo of medical school and medicine. And she kind of said, "Hey, Misha, do you know about Prevent Blindness Texas?" And I said, "I don't think so," which is crazy to think that I wasn't aware, but it speaks to, our job is to really make all our providers aware of this organization and a big part of our mission. So I said, "No, not really." She said, "Well, look into it. They are looking for board members, and I think you'd be great." And this was, I think, must have been around 2015 or 16, somewhere around there. So I was pretty, well established in my clinical practice by then, and I had kind of gotten the residency program director thing in hand, more or less. And I felt good about where I was career-wise. So it was a perfect timing for me to start looking at that. Like, how do I get more connected with the larger vision community and find a way to affect that change at that level for my patients and for our community? So I looked into it. I thought, this is what I've been looking for, and was fortunate enough to come on board at the same time within a few months of when you came on as CEO, Heather. And I still remember those board meetings in Houston, sitting around the long table in our old PBT building. Yep.
Yeah.
And really just being amazed at who was in that space, who were the board members and people I never would have had the chance to meet and connect with otherwise. And I think that's what hooked me. I thought, wow, this is really cool. All of these people have this same goal in mind, and we're all coming from such different perspectives and directions, but this is unifying us. And then I was sold. So, and seeing how you developed the organization from the time I joined and what you did to really take us to a whole other level and become, highly functioning, cohesive, driven in our efforts. I have learned so much from being able to participate as I have as a board member and being it was funny, when I was trying to pick what committee to join when I came on, I thought I need to stretch my wings a little bit. And as academic physician, business, marketing, I don't have a bone in my body. That was part of the reason I went into academics, quite frankly, is that I don't want to run a business. I'm not really interested in that. And I thought, let me join the development and marketing committee. I'm going to stretch myself. And I am so glad that I did that, because understanding how to sell
Yeah.
is a huge skill,
Yeah.
very important skill to have. And PBT has really helped me understand that part of my job and how to do that. So thank you for that, PBT. um, and I think as I did that and kind of moved into the executive board member roles, being able to serve as vice chair, seeing that I could actually do it, I think there was a bit of me, and the imposter syndrome was rearing its head. Look, this is so out of my element. I don't know if I'm the right person. I said I'm happy being on the board, but I don't know if it's in me to lead this group of people. Again, amazingly talented, diverse people who make up our board. And I thought, I don't know if this is me, but I appreciate you, Heather, kind of giving me the little nudge and the yes,
Yep.
I think you can do it. And walking through that door again, and taking the roles that I did and now ending in chair. I mean, I can't say enough how it's helped me grow as an individual, understanding team dynamics, working on the inevitable challenges that come up in an organization and a nonprofit in particular, understanding the financial side of things more clearly, and how that plays such a big role in being able to accomplish the mission. So seeing that from the chair perspective, and building what we have with our board members and the PBT staff, again, I couldn't have asked for a better addition to my career path.
Well, it's been amazing having you as board chair. I met when we had our board meeting, and it's in this role as CEO. That board chair position is really important. The executive committee is really important, just because it changes. If you don't have a good relationship, it definitely impacts the day to day. But to have incredible relationships and work so well as a group and really challenge each other to think about how to do it differently. You just look at the growth of the organization over the last 3 years. It has been amazing, but it really is because of the leadership, right, at that board level, that we trusted each other to be able to come and say, hey, this is the issue, or what do you think about this, or how do we do it differently, or how do we push the board. So it's just been an amazing experience.
Yeah, couldn't agree more. And it's
All
really
right.
fun. The events are fun. I'm going to add that too.
The events are fun.
I really love being a part of those and helping plan, and had to put on my party planner hat, which is fun. So
It's fun. So if you were going to um, tell someone why to be a part of PBT, what would you tell them?
So I would say, if you want a growth opportunity that you that gives you as much as you give it, I think PBT is the absolutely right place to be. I think you have to understand what you bring to the table, and us being intentional as the board, I think, with recruiting people who bring different skill sets and perspectives is the first part of that. But if someone is considering being a board member, has been asked to be a board member, think about that, because bringing yourself to the table, and being willing to grow and participate in that way, is just as important as what the organization is going to provide you. So absolutely have that duality, that understanding, and it really is a win-win when you have that connection, the right connection.
All right. Okay, so let's talk a little bit about eye health.
Mm-hmm.
So, what's the first thing that comes to mind for you when someone says eye health?
I'm going to go back to the prevention piece.
Mm-hmm.
So eye health, I think, is something that people don't consider when they think about health in general. And it is part of the PBT mission to bring eye health as a piece of overall health to that forefront.
Yep.
But I do firmly believe in pushing forward screening, regular eye exams. I think far too many people don't get that at least, first baseline eye exam or screening until they're already in that uh, point in life where those preventable causes of vision loss have already started.
Yeah.
So I think our system does a pretty good job of screening in the younger school age population. But I think where that maybe falls down is once that initial screening happens, is enough being done to make sure that those children who screen in, who may have an issue, are they plugged into the right resources to go that next step? And that is extremely important. And I would say the other piece that that we need to think more about is if you have any family history of any eye disease, making sure that you and your family members understand that that in and of itself means that you have to, even if you're not having any vision problems and you're not having eye pain and you're cruising along, you need to get screened earlier than, we say roughly the age of 40, you should start having an eye exam every 1 to 2 years. But that doesn't hold for if you have any family history. So getting that message out, I think, would help prevent a lot of disease. And as a glaucoma specialist, I get it all the time. People may get diagnosed with glaucoma the first time they're sitting in my clinic in an exam room, and they say, well, how did this happen? I have no pain, I have no vision loss. And glaucoma is the silent thief of sight. It will not give you those clues that anything is happening. The only way to catch it is getting that screening exam.
So let's talk a little bit about disease and risk as related to eye health, because I've been in this position for almost 8 years, and I still am amazed, and not in a good way, that there's this disconnect between chronic diseases and even some medications that we take and the impact to vision. So talk a little bit about how, you when you first came into the profession, what it looked like, and now what do you think has changed? Do you think we've done a better job of making that connect? What else still needs to be done for people to really understand how important it is to know that connection between chronic disease and eye health?
That's such a great question. I think the education piece, certainly we need to let patients know, when they have systemic diseases like diabetes or high blood pressure, both of which are extremely common in our population, right? In the general population. Having them understand that they have to get their eyes screened as part of those disease processes is part of it. And I think we're doing a so-so job, to be honest, on a national level. It's just the numbers aren't there for patients getting appropriately screened. But it's not just the patient education piece. We have to educate our colleagues. We have to educate our primary care providers about getting these patients into a proper complete eye exam as soon as they're diagnosed with these several systemic diseases like we talked about. And that also, I think, is getting better. I think PBT is actually playing a really important role in that, and not only us as an affiliate chapter, but the National Prevent Blindness organization is really working hard to do that. I think our healthcare system makes that access tricky. We move into that whole idea of patients being insured, partially insured, uninsured, and the system kind of falls apart to plug them into the resources they need when they have these varying levels of access. Incredibly important for PBT and other nonprofit organizations to help fill that gap when it's there. And I think we're getting better, but there's a lot more we can do.
Yeah, agreed. So what are some risks? What puts you at higher risk for eye disease? Walk through some of those things.
Right. So there are some things that are kind of inevitable. Age is one.
Yep.
I tell my patients,
Unfortunately, it is.
yep, if you are on this earth long enough, there are some eye conditions that are going to happen, particularly cataracts. We can start with that. A very common process in the eye. I'm not going to call it a disease. It's actually an aging process. And so, especially living in environments, climates that are more sunny, closer to the equator, UV exposure is one of the risk factors for developing cataracts along with age. So we're in our, Sun Belt area, we are definitely at relatively higher risk for developing cataracts. So that is one thing, one disease. I would say some of the other diseases, remind me again, you wanted me to talk about risk factors?
Yeah. So what
Yeah.
are some of the risk factors
Yeah.
for some of the most common eye diseases?
Right. So cataracts, sun exposure, smoking can increase your risk of developing cataracts earlier in life. Going back to that systemic connection, diabetes is actually a risk factor for cataract development. And I see patients who are sometimes in their 30s and 40s, with diabetes and developing cataracts when normally you would expect it maybe a few decades later.
Yeah.
Patients being on certain medications, particularly steroids, can cause cataract formation earlier in life. Glaucoma is another disease that's age-related. So again, getting that regular screening, particularly after the age of 40, if you have no other risk factors for glaucoma, such as family history, which we mentioned, that's really a key to preventing vision loss. Many of my patients who were caught in time with glaucoma, or who I follow as what we call glaucoma suspects, they will hopefully never develop any visual loss from that disease process because we can manage it, we can control it if it's caught in time. Very similar to diabetes and the complications from ocular complications from diabetes. If the diabetes is managed really well and caught again in time and the eyes monitored, you may have diabetes for more than half your life, but never get ocular complications. That's the best case scenario. But the only way that happens is being plugged in to a provider and making sure you're getting those annual screenings.
So when you think back over, your career and your practice, are there certain patients that stand out to you and why? Good or bad, right?
Yeah.
Challenging, hard case, or something that someone that just made a lasting impression on you.
Wow. Yeah, it's funny, as we've been talking, I actually have had particular patients flash in my mind as we talk about certain things. I'll go to glaucoma first. I've had some really memorable glaucoma and cataract patients, but with glaucoma, it's one of those really kind of hard situations like we talked about that can be really challenging mentally, emotionally to deal with. I had a colleague actually who's a physician and came in, saying, I'm just not seeing as well. Not sure why. It's just things are quite as clear as I would expect. And I proceeded to check them, and they were actually in a very advanced stage of glaucoma in one eye, very advanced. So this is clearly someone who has had access to healthcare, right? Insured their whole life in the medical field.
Yeah.
Understands, all of the things that we're talking about, but still, this was not caught. And just tragic, thank goodness the other eye really is not that affected yet. So we are managing, we're controlling, but having to explain to them every time, I'm really sorry, but we cannot bring that back, what you've already lost. And it affects their professional work. It affects their personal life. They've talked about people coming up on one side and not realizing that someone's there till they're right there. And that can be jaunting, and it's just, those are little things we don't think about, but they are actually very much built into our quality of life. Driving, obviously this person needs to drive around. They're a busy clinician, and having that understanding that they do not have as great peripheral vision and how to compensate for that when they're doing those kind of activities like driving and walking around. So very memorable, challenging. And it really should be a best case scenario, but it's not,
Yeah.
even with all the resources that individual has had. So, and I'd say, at cataracts, I had a really interesting patient years ago, who was an artist and had
Mm.
come in, had really not had regular insurance and access to healthcare. And we actually took care of them at UTMB with our, um, years ago, we had a kind of a grant fund called the Indigent Care Fund. And
Mhm.
so I was able to see this patient through that, and he had very advanced cataracts, very advanced. And he said, I can't paint anymore. And, for him, it was
It's
just
life. Mhm.
exactly his life, life altering, very depressing, of course, and not only quality of life, but being able to function, from a work aspect, wasn't able to do his livelihood. So we had the conversation, said these are cataracts that are significant. When they do come out, they were so significant that I actually couldn't see well in the back of the eye to ascertain if there was any other eye disease. So, we always have to have that conversation with our patients with advanced cataracts. Sometimes we don't know what we're going to find
Yeah.
once the cataract comes out. So I said, hopefully you're not going to have any other problem in the back of your eyes, but we just can't see till we get the cataract out. So if you're wanting to go ahead, we can provide the cataract surgery, and see how well we can get you seeing. And he was of course on board, and thankfully he had an amazing outcome, didn't have other eye pathology. And I mean, just to have his reaction, I still remember, seeing him in the post-op day one visit, and he was floored. He was ecstatic, and being able to make that kind of change in someone's life, that immediate coming back into the world, he had lost his footing in a way of his life as an artist, and just being able to contribute the
Yeah.
way he wanted. And to, I think that going back to why I went into ophthalmology, and remembering that I really saw that piece. It's not only prevention of disease, but being able to make these incredible life-changing interventions for a patient. It just kind of was like full circle. I mean, the gift that we have to be able to do that for patients. So I still remember his name. I could picture him, and it was just amazing. So
Yeah. It really touches on, I think, what we try to convey so often is um, vision is complicated and it's so tied to so many things in our life that we don't even think about, right? The mental health component when you have vision loss, right? Other parts of our body, disease, the quality of life. Um, and I just think those are really important pieces as we continue to talk about vision and eye health. It's all those pieces, it's this web that's all connected, and how important it is to really prevent vision loss. And we really can.
right.
Um, so one piece of advice you'd give as people are thinking about their eye health, like what's the most important, what's the takeaway you want them, if they remember nothing else about our conversation, what's the one thing you want them to
Ah.
take away?
I would say, the saying, if it ain't broke, don't fix it. Ignore that when it comes to your eyes.
I like that.
You've got to get in before it's broken, and make sure that you are plugged in so you don't have to fix it. Like we
I
talked
like
about,
that.
so much is preventable, but you got to be checking for
Yeah,
these things. So,
yeah, yeah. All right. So we talked a little bit about why people should get involved with Prevent Blindness Texas. And we are always looking for people to engage with us at all different levels, board, event committees, helping us screen in the community, helping us to educate in the community. So there are all different ways to engage with us. But I do think it's an incredible experience at all different levels, and to come in, and it's just an organization filled with amazing people. And like you said, from all different backgrounds, all different perspectives. But it really is, I think, like a family. We really
mhm.
do have a great group that are involved in moving this mission forward. Thank you so much for being a part of today and the conversation. It was great. And thank you for sharing your expertise and your insight. We deeply appreciate everything you do and everything you do for PBT.
Thank you, Heather. It was an honor.
Well, it's great to work with you. You know, you're not going anywhere, even though you are rolling off the board. You're still not going anywhere.
I appreciate that. I don't want to
Uh,
go anywhere.
and for all of you listening, we appreciate you spending your time with us. Don't forget, please subscribe to Eyespiring with Prevent Blindness Texas, and always let us know what your vision is.